Let me tell you something, friend. If you're over 60 and you've quietly noticed that the spark of intimacy, that youthful vigor you once took for granted, just isn't what it used to be, I want you to know you're not alone. Maybe you've scrolled through countless remedies online late at night, feeling a kind of quiet desperation that you'd never admit to your buddies down at the coffee shop. Maybe you've wondered if this is just what getting older means, if you're supposed to just accept it and move on. Well, I'm here to tell you there might be a natural, surprisingly simple approach that could help rekindle that flame. And I want to be straight with you right from the start, because you deserve honesty, not hype. My name is Dr. Olivia Grant. I've been practicing medicine for over 30 years now, with a focus on men's health and urology. And in those 3 decades, I've sat across from thousands of men just like you, here in my clinic in Charleston, South Carolina. I've heard the same quiet worries, the same frustrations, the same hopes. Today, I want to talk to you about something I've seen generate real interest lately: the use of castor oil for men's intimate health after 60. Now, you've probably seen headlines out there promising instant erections. Let me be honest with you, folks. Instant is a word I don't trust when it comes to the human body. There's no magic bullet, no overnight miracle. But what I can tell you, based on traditional use, emerging research, and what I've observed in my own practice, is that applying castor oil to specific areas may offer some genuinely interesting benefits for your intimate health. I'm going to walk you through what we know, what we don't know, and most importantly, what you need to watch out for. Because the last thing I want is for any of you to try something without understanding the full picture. Before we get into the castor oil itself, I want everyone to understand what's actually happening in your body after 60. This matters because when you understand the problem, you can make smarter choices about the solution. The first challenge is reduced blood flow. Your arteries over time can become less flexible. Think of a garden hose that's been sitting out in the Carolina sun for too many summers. It just doesn't expand and contract the way it used to. This means less circulation to the delicate areas down below, and that directly impacts your ability to achieve and maintain strong erections. The second challenge is tissue stiffness and what we call fibrosis. Over the years, the tissues in the penis can become less elastic. Tiny microscopic scars or plaques can build up, leading to discomfort, changes in shape, and reduced function. It's a gradual thing, and most men don't notice until it's already well underway. The third challenge is chronic low-grade inflammation. This is the silent troublemaker. Persistent low-level inflammation in the pelvic area can quietly limit performance, sensation, and overall vitality. You don't feel it like a stubbed toe, but it's there, wearing things down. The fourth challenge is declining nerve sensitivity. The delicate nerves responsible for sensation and arousal can become less responsive with age, diminishing pleasure and connection with your partner. And let me tell you, that emotional side matters just as much as the physical. The fifth challenge is skin changes. The skin in sensitive areas becomes thinner, drier, more fragile. It's less resilient than it was at 30, and it needs more care. Now, I want to pause here and say something important. Not every man over 60 experiences all of these issues. I've had patients come see me at 75 who are doing just fine, thank you very much, and I've had men at 55 who are struggling. We're all different. But if any of what I just described sounds familiar, I want you to know that it's not a moral failing. It's not something to be ashamed of. It's biology, plain and simple, and there are things you can do about it. So, let's talk about castor oil, which has a long history going back to ancient Egypt and traditional medicine in India. That humble, thick, pale yellow oil pressed from the seeds of the castor plant has been used for generations for all sorts of ailments. My own grandmother, bless her heart, kept a bottle in her bathroom cabinet her whole life. The active component folks talk about is ricinoleic acid, a fatty acid with some interesting properties. Research suggests it may have anti-inflammatory effects, may help with pain relief, and may support circulation when applied topically. I want to be clear with you. We don't have the kind of large-scale clinical trials on castor oil for men's intimate health that we have for prescription medications. A lot of what we know comes from traditional use, smaller studies, and clinical observation. So treat this as a complementary approach, not a replacement for medical care. Here's what castor oil may do when applied consistently and correctly. First, it may support circulation in the areas where you need it most. Ricinoleic acid has been studied for its ability to potentially stimulate blood flow and lymphatic drainage. Better circulation means more oxygen-rich blood reaching the intimate tissues, which supports healthy function over time. I want to emphasize over time because this isn't an on-demand solution. It's a slow, steady approach. Second, it may help with tissue flexibility. Castor oil is known for its deep penetrating quality, and some practitioners believe it may help soften tissues and gently address minor adhesions. The goal here is greater comfort and potentially more youthful sensation and function. Third, it may help calm inflammation. A lot of age-related issues are fueled by that chronic low-grade inflammation I mentioned earlier. Ricinoleic acid has demonstrated anti-inflammatory properties in various studies, which may help create a healthier environment for optimal intimate function. Fourth, it may support nerve health. The combination of improved circulation and reduced inflammation creates conditions that are generally favorable for nerve function. Now, I'm not going to tell you castor oil regenerates nerves because that claim goes beyond what the evidence supports. But a healthier tissue environment supports healthier nerve function. Fifth, it nourishes and hydrates delicate skin. This one we're on firm ground with. Castor oil is a well-known emollient. It provides intense moisture, forms a protective barrier, and helps keep skin supple. For men over 60 dealing with thinner, drier skin in sensitive areas, this alone can make a real difference in comfort. Now, before I give you the application protocol, I need to have a serious safety conversation with you. I'm going to be more direct about this than a lot of videos you see online because my job is to look out for you, not to sell you something. Castor oil is generally considered safe for topical use, but there are real cautions you need to know about. Some people have allergic reactions, so you should always do a patch test on the inside of your forearm 24 hours before applying it anywhere sensitive. If you see redness, itching, burning, or swelling, stop immediately and wash the area with mild soap and water. Do not apply castor oil to broken skin, open wounds, or active infections. Never apply it directly to the urethra or the glands. If you're on any blood thinning medications, talk to your doctor first, because castor oil may interact with those. If you use condoms, be aware that oils can degrade latex, so this approach is not compatible with latex barrier protection. And here's the most important thing, folks. If you have erectile dysfunction that is persistent, if you have chest pain during intimacy, if you have blood in your urine or semen, if you have significant pelvic pain, if you notice any unusual lumps, you need to see your doctor. These can be warning signs of cardiovascular disease, diabetes, hormonal imbalances, or prostate issues. Ignoring those symptoms is like ignoring the check engine light on your truck. It's not going to go away, and it might be telling you something serious. Okay, with all that said, here's the simple application protocol I share with patients who want to try it as a complementary approach. Step 1. Choose a quality oil. Look for 100% pure cold-pressed hexane-free castor oil. Organic if you can find it. You can get it at most pharmacies, health food stores, or order it online. Don't buy the cheapest bottle you can find. Quality matters here. Step 2. Pick the right time. I recommend evening after your shower before bed. Wear an old pair of underwear or boxers because I'll tell you from experience, castor oil will stain your nice sheets and your good shorts. My patients joke about keeping a dedicated pair of castor oil boxers, and honestly, that's not a bad idea. Step 3. Start small. A few drops is enough. About a quarter teaspoon in your palm. You don't need to slather it on. More is not better. Step 4. Apply carefully. The target areas are the perineum, which is the space between the base of the scrotum and the anus, the base of the penis with gentle upward massage toward the base, the underside of the shaft along the lower surface, and a thin layer on the scrotal skin to nourish that delicate tissue. I'll say it again because it matters. Never apply directly to the urethra or the glands. Step 5. Use a gentle massage technique. 1 to 2 minutes is plenty. Slow circular motions. Let the oil absorb. This isn't a vigorous workout, it's more like a gentle ritual of self-care. Step 6. Consistency is the key. Make it a nightly routine. The benefits, if you're going to experience them, come from steady, consistent application over weeks, not from one enthusiastic night. If you want to give this a real shot, I suggest a 14-day trial. For 2 weeks, commit to this simple nightly ritual. Apply castor oil to the areas I mentioned. Massage gently for 1 to 2 minutes. Do it every night before bed. And pay attention to how you feel. Notice any changes in comfort, sensation, or confidence. Your body will tell you whether this is working for you. And I want to remind you, while you're doing this, don't neglect the other foundations of men's health. Walking daily, even just 20 to 30 minutes, does more for your circulation than almost anything else. Staying hydrated matters. Managing your blood sugar matters. Getting enough sleep matters. Reducing stress matters. Castor oil isn't a standalone solution. It's one small piece of a bigger picture. Let me share a story with you. I want to call this patient Robert, though that's not his real name, to protect his privacy. Robert came to see me about a year ago. He's 68, a retired high school principal from just outside Asheville, North Carolina. He sat in my office with his hands folded in his lap and said, "Dr. Grant, I don't even know how to talk about this." Robert had been married to his wife Susan for 42 years. He told me that their intimate life had gradually faded over the past several years, and it was wearing on him in ways he hadn't expected. "It's not just the physical side," he said. "It's that I feel like I'm losing a part of who we are together." He was skeptical of prescription medications because of some heart concerns, and he wanted to know if there was anything natural he could try. We talked for a long time that afternoon. I walked him through the 5 challenges I just described. I explained the castor oil approach as one option, along with lifestyle changes, cardiovascular assessment with his primary care doctor, and open communication with Susan. Robert, being the practical, methodical man he was, took notes. He went home and did his own research. He went to his cardiologist and got the all clear. He started walking every morning before breakfast, and he committed to the nightly castor oil routine. 2 months later, Robert came back for a follow-up. He was a different man, not because he was 30 again, because nobody becomes 30 again. That's not how this works. But there was a lightness to him. He told me, "Dr. Grant, it's not that everything is back the way it was in 1985. It's that Susan and I are connecting again. There's warmth, there's comfort, there's a willingness to try on both sides. And that's been worth more than I can say." That's the real goal here, folks. It's not about chasing some fantasy of youth. It's about feeling present, comfortable, and connected in the life you have right now. I want to address some concerns I know some of you might have because I have heard them from patients and I've seen them come up again and again. Some of you might be thinking, is this really safe? And the honest answer is, for most healthy men, topical castor oil applied externally, as I described, is generally well tolerated. But it's not universally safe for everyone. If you have sensitive skin, if you have allergies, if you have underlying conditions, please talk to your own doctor first. A 5-minute phone call to your physician's office can save you a lot of trouble. Some of you might be thinking, why haven't I heard more about this? And that's a fair question. The truth is, natural remedies don't have the marketing budgets that prescription medications do. There's also been less rigorous scientific study of traditional remedies, like castor oil, for this specific use. That doesn't mean it doesn't work, but it also doesn't mean it does. It means we're in a space where clinical judgment and personal experimentation, with appropriate caution, have to fill some of the gaps. Some of you, and I've seen this in comments on videos like this, might be wondering if this is just a sales pitch. Yes, it is. Let me be clear, I'm not selling you castor oil. You can buy it at any drugstore for 10 or 15 bucks. My goal is to share information, not to push a product. And some of you might be dealing with specific situations that make you wonder if this applies to you. I've had patients ask about recovery after prostate surgery, after treatment for rectal or bladder cancer, after pelvic radiation. For those men, please work directly with your urologist or oncologist. Recovery from those treatments is specialized, and natural approaches may or may not be appropriate depending on your specific situation. Don't go it alone. Let me also say a word about magnesium because I've seen that come up in conversations about men's health over 60. Magnesium is an important mineral for muscle function, nerve function, and cardiovascular health, and many older adults are deficient. If you're interested in that angle, talk to your doctor about getting your magnesium levels checked and consider whether a supplement makes sense for you. That's a separate conversation from castor oil, but it's part of the bigger picture of men's health after 60. Castor oil also has some additional benefits beyond the intimate health conversation that are worth mentioning. Topical application can support lymphatic circulation, which is important for overall detoxification and immune function. Many men over 60 deal with joint stiffness. and topical castor oil can provide some soothing relief when massaged into sore joints. It's also excellent for dry skin, brittle nails, and hair health. Some folks use a warm castor oil pack on the abdomen for digestive comfort. So, even if you decide the intimate application isn't for you, there are other ways this humble oil might find a place in your self-care routine. Now, I want to leave you with a practical action plan because I know some of you are the type who want clear next steps. Step 1. If you've been dealing with intimate health concerns, schedule an appointment with your primary care doctor or a urologist. Get a full workup. Check your blood pressure, your blood sugar, your cholesterol, your testosterone if appropriate. Rule out the serious stuff first. This is not optional. This is the most important step. Step 2. Look at your daily habits. Are you walking? Are you eating whole foods? Are you sleeping well? Are you managing stress? Are you connecting with the people you love? These foundations matter more than any oil or supplement. Step 3. If you want to try castor oil, go to your pharmacy or order a bottle of high-quality, cold-pressed, hexane-free castor oil. Do a patch test. Commit to the 14-day trial I described. Pay attention to how you feel. Keep notes if that helps you. Step 4. Communicate with your partner if you have one. So much of intimate health is relational. Don't suffer in silence. The conversation itself, awkward as it might feel, often does more than any single remedy. Step 5. Check back in. If you try this for a month and notice improvements, great. If you don't notice any difference, that's also useful information. Not everything works for everyone. And if you notice any negative effects, stop and consult your doctor. I want to close with this, everyone. Your vitality doesn't have an expiration date, but it also doesn't come in a bottle. It comes from how you live, who you love, how you move your body, what you eat, how you sleep, and yes, sometimes from small daily rituals of self-care that remind you that your body is still worth tending to. After 30 years of practice, if there's one thing I've learned, it's that the men who do best after 60 are the ones who approach their health with curiosity rather than shame, with patience rather than panic, and with honesty rather than magical thinking. They ask questions, they see their doctors, they try things, they adjust, they stay connected to the people they love. Castor oil might be a useful tool in your toolbox, or it might not be the right fit for you. Either way, I want you to walk away from this conversation knowing that what you're experiencing is normal, that you have options, and that you deserve honest information from someone who actually respects your intelligence and your time. If this has been helpful for you, I'd love for you to stick around on the channel. I cover men's health topics after 50, 60, and beyond with the same honest approach. Share this with a friend, a brother, a buddy, who might be quietly wondering about some of these same things. Men don't talk about this stuff enough, and the silence does more harm than any honest conversation ever could. Take care of yourselves, see your doctor, and remember, the goal isn't to turn back the clock. The goal is to live fully, comfortably, and connected in the years you have. That's something worth showing up for every single day. This is Dr. Olivia Grant, and I'll see you in the next one.